Hi, my name is Michelle, and I'm going to be interviewing this young man, Kenneth. So tell us about where you work.
I work in a place called Copestone, which is an attachment to Mission Hospital in Asheville. I deal with a lot of different kinds of mental illnesses. With Copestone, it's more of a stabilization unit to kind of help people if they are in some kind of crisis and hopefully identify some problems, maybe prescribe some medicines, and hopefully get people back to either normal or in a safer place.
Oh, interesting. Yeah, I used to work at Mission in the ER, so I used to send a lot of people over to you.
Okay.
So how is your job affected by homelessness?
Well, I feel like a lot of our patients are homeless. I feel like mental illness and homelessness go hand in hand. So we do deal with a lot of homeless people with mental illness.
Why do you think homelessness is such a problem in Buncombe County?
There's a lot of factors that I think pertain to that, but I think one of the bigger ones would probably be that mental health is not, funded as much, and it's not as big of a problem as people think it is. It's huge, and I think it goes underdiagnosed, and I think it's just, people fall in hard times there and then they never get a chance to get back up because of either mental illness or drugs, addiction. All that stuff go hand in hand with that as well.
I 100% understand and agree with you. What are some things we could do differently as a community to help the homeless?
Well, I think one of the main things is obviously raise awareness. I feel like we do the best we can with what we have there at the hospital, but at the same time, I feel like when we release people back out, they don't really have anywhere to go. I mean, it's just such a hard thing to deal with. Being at the bottom, and even though you may have got some help for a moment, but that help does not really continue as much after the fact.
Totally true. What do you think the county could do to help the homeless?
I think one of the main things is having more places for homeless people to go other than the streets. That also goes hand in hand with actually having people being readily available to help these homeless people, and to also offer either some kind of way to have housing as a homeless person who does not have a job, maybe offer a job, or at least try to teach people how to have a job, and then of course, housing is super expensive.
And why do you think addiction is such a problem in Buncombe County?
Again, it goes back to it's hard to live there. Buncombe County is an expensive place to live, and a lot of our months are cold. So if you are homeless, you got to do something to at least forget that you're homeless, forget that you're on the streets and you don't have food and you can barely eat and you have no money. I feel like addiction is just, people just want to forget that for a second. It's a hard life, and drugs, and unfortunately make you forget that, and that I feel like becomes very addictive to not have to feel hungry and cold and sad all the time. I think that's a big deal.
Very sad. What are some things the community could do differently to help the homeless people break addiction?
I think one of the main things is we need places for people to live. And we also need people to help set that up. We need to have places set aside for that. The next thing would be to have people available to help these people get back on their feet as far as jobs go, as far as being self-sufficient. I think that's a main thing. Maybe giving a purpose. I think people who don't have a purpose, what's the point for them to do anything anyway? Why would they come out of the addiction if the addiction makes them forget all these things and they have nothing else to look forward to?
It's true. Why do you think mental illness is such a problem in Buncombe County?
Lack of funding is a big one. I feel like we don't have near enough psych facilities and things like that. there's so many things, really, that, like, I don't know how to describe it, that just pertain to that. I mean, it could be something as small as losing your job and not being able to afford housing. That's like that happens a lot. Like I said, Buncombe County is expensive, it's not like a cheap place to live, Secondly would be losing a purpose in life. I mean, if you have nothing to live for, then you just kind of fade away, I think that's just a big thing, and then of course on top of that, there's so much problem with addiction now, and then people getting other people hooked onto that. And it's not stopping, it's spreading, as far as that goes. So we're not really doing anything, in my opinion, that stops that part of the aspect either. So there's a lot that goes into just that. I mean, it's not just one thing, and it's not that Buncombe County is the only county that's dealing with this either. I mean, everywhere in the world is like that, I just don't think we're aware of it, and I think most people aren't aware of it, especially like local leaders and things like that. I think that it's on the back burner at best.
And it's a really vicious cycle. Also, my time working in the ER at Mission, I remember there's like only 890 beds, psych beds for the whole entire North Carolina state. And also, the recent closure of Dorothy Dix Mental Hospital did not help that situation at all. It's just taken away even more beds. Yes, I agree. What are some things you think the hospital could do differently to help mental illness?
I think having that psych facility is a big deal. Unfortunately, we are still understaffed a little bit, but I do think that if there was a way for us to at least hire like more social worker people who can either keep in touch or have a way of staying beside these homeless people who come in and have these mental illnesses and things, if we can just help them, like I said, find a purpose and get a job, and have a safe place to live and kind of take them out of the vicious cycle you were talking about earlier, get them out of that situation. I feel like you need people to help people. We just don't have enough. And I think that if the hospital could find more people, I think that's the biggest thing. I mean, I think by far.
I agree.
People.
I think
we
it's
need
like
people.
Everywhere.
Yeah,
sure.
Everywhere.
If we do nothing now, what do you think the future holds for the homeless people?
Well, they don't have a future. I mean, that's just that. It's that simple. There's no future there. And then, as people do reproduce. That's just the thing in life, and every kind of living organism does at some point, And if people are born into bad situations, 9 times out of 10, they're not getting out of that bad situation, So the future is looking a lot scarier than people realize, and it only gets worse, That's why we just need more people, more funding. I mean, it needs to be aware. We need to be aware of it. We just do. That's just that.
I know, back in my day working there, I remember seeing a bunch of children born into that situation, and it's very tough because they grow up having these problems with depression at a very early age, as early as even 6 years old. It's tough. It's tough for sure. Well, thank you so much, Kenneth. I appreciate your time.
No worries.